Ooh, that is a bright light. Good afternoon. Oh, I'm sorry you have to see me so well. I'm Gary Slack. I'm the Chief Medical Officer at Aquestive. I appreciate you all taking the time this afternoon. My presentation is going to be actually quite brief, so you probably are tired at this point of the day. Aquestive is a specialty pharmaceutical company that has a film strip technology that I'm not sure many of you are familiar with. This is the package for the film. It's quite small. It's kind of like a Listermint strip. And Aquestive has developed this technology. We've been doing this for at least 12 years on a variety of different kinds of medications. Some of them probably are, most of them probably are not necessarily familiar to this audience. Suboxone, which is a medication for opioid withdrawal. We have used this technology for medication for ALS, Riluzole. And one of the applications is for Clobazam, Sympazan, which is a medication I'll talk briefly about for LGS epilepsy. And we have also are developing a film for a medication applied for diazepam for an indication like Nasolam that you just heard about from Michelle. That was a very nice presentation, by the way, about seizure clusters, and that's awaiting FDA approval. And we're actually using the same technology to develop a similar a rescue medication for anaphylaxis to replace EpiPen. So it has a lot of applications, and for patients who have special delivery needs, such as LGS, we've had great success in applying this technology, and it's new and it's different. And for people who aren't able to swallow easily or aren't able to inject themselves with a needle, they find great utility in a technology like this. So I'm Gary Slacko, Chief Medical Officer. I've been with the company for about 4 years. I've been developing medications longer than I can remember. And I have actually previous to Aquestive been with the FDA about 6 years in their drug safety division. The technology is, as I mentioned, we can coat the medication onto a small film. It can be applied to either the buccal mucosa on the inside of the cheek. It can be applied on top of the tongue in the case of Clobazam or Sympazan, which we'll talk about. In this case, it's the one I will talk about, or it can be applied under the tongue for some of the other applications. In the case of Sympazan, the film strip is applied on the tongue. It dissolves without any need for water or any use of liquids. It simply dissolves. It's dissolved in the GI tract, so the film strip melts on the tongue, and it's swallowed. And it reaches its maximum concentration in about 20 minutes, and it's completely absorbed in the GI tract. So there's not a risk of loss of medication, as can happen with some of the other formulations that are available. Of course, it's a prescription medication. It's a scheduled medication. It's a benzodiazepine, as you all know. It's indicated for treating Lennox-Gastaut epilepsy in people who are 2 years of age and older. It's a thin, berry-flavored strip. Patients tolerate it very nicely. It comes in the 5, 10, and 20 milligram strengths. So it has a full range of dosage strengths for covering the spectrum of patients' needs, and including a 5 milligram strength, as I mentioned. So for patients who might have difficulty in using a liquid formulation or other alternative formulations, it's a very useful option. If they have difficulty swallowing, if there's difficulty with keeping the liquid formulation in their mouth, or receiving the entire dose, or if you're having to crush the formulation and they're not getting a full dose all the time, this formulation has proven to be very useful for a lot of caregivers in terms of making sure that the patient always gets the full dose every time. And so we've gotten a lot of very good feedback. Prescribers that use this medication have found it to be a very effective alternative, and have generally decided that they want to keep using it in those patients, and have prescribed it to a large percentage of their LGS patients when they started to use it. It is also useful because it's very low carbohydrate content. So for patients who are being considered for a ketogenic diet, this has become an interesting option for them, and prescribers are considering using it for that group as well. I have some safety information at the end of the talk regarding Clobazam, so I won't go through that here. You heard some from Michelle about some of the safety risks with benzodiazepines. In this case, this is a chronic medication, so there are additional concerns that are different than with Nayzilam. In particular, these medications have a black box warning for concurrent use with opioids, and they should be prescribed very carefully. And anybody who's taking concurrent opioids, obviously there's a risk of addiction. These are scheduled medications. They should have a risk of misuse, abuse, and addiction. They should be used. They cause sedation, obviously, and in particular, they need to be very carefully withdrawn because they can cause very significant adverse effects if they are suddenly withdrawn. They need to be tapered off very slowly over a long period of time. So there is an enormous list of adverse events associated with the use of these medications, and that includes Clobazam and includes Sympazan. I had a longer presentation for a medication that we have in development called Libervant, which is a buccal formulation of diazepam for seizure clusters, as Michelle was describing earlier. This medication is a oral film alternative to diazepam rectal gel, which has been previously indicated for cluster seizures, as you heard earlier. It has been filed and is awaiting FDA review and approval. It is in the review process. It is not something that we can discuss in any kind of detail other than to say that it is under review. We believe it is a significant contribution to patient care. It has not yet been approved, and when we believe it will be a transformational medication for patients, and when it is, we are obviously hopeful it will be, and when it is, we are ready to introduce the medication. So my talk today is much shorter than I had planned. I hope to present a lot of scientific information for you about this medication. When it is, I will be happy to come back and share that information with you, and I really can't answer any questions about it. Here is the information I shared about this. I'm happy to discuss this with you, or you're welcome to walk up to the booth around the corner and talk to the representatives there about the safety information about Clobazam and Sympazan. Thank you very much. Appreciate it.